Hi, I'm Dr. Greg Oliver and welcome to Fast Clinical Weight Loss. I'd like to invite you to take the opportunity to look at what we have to offer you. Have you ever said to yourself, I just can't lose weight? I've been on every program. I've been on this program and that program and I lost some weight but it went back up. That's kind of normal. Let me tell you the facts. About 95 to 97% of the people who lose significant weight gain it back. Only a small number will keep it off for a long term. There's a reason for that. There are reasons that you can't lose the weight, but we're going to go over those reasons and we're going to help you. And if you so desire, we'd love to work with you to help you lose that weight forever. Okay? One of our slogans is Forever Thin. Now, we want to also help you get to what we call your best weight. Not everybody's going to be skinny. But if you're overweight or you're carrying significant weight, we want to get you to your best weight, the weight that you're healthy at, the weight that you can live the longest at, the weight that you can be active at. So let's talk about why you just can't lose the weight. Well, most people think that weight loss is all about behavior and all about willpower, and that's not true. Weight loss, obesity, is a disease. So obesity is a disease just like high blood pressure, just like diabetes, just like arthritis. Think about this. When we treat those diseases, they get better. If you treat high blood pressure, the pressure goes down. If you stop, it goes back up. Diabetes, if you treat it, the blood sugar goes down, but if you stop treating it, it goes back up. In all diseases, if you don't treat it, it goes back up because it's genetic, it's biochemical, and yes, environmental and behavior factors are important in those things. With obesity, if you treat it, if you focus on it, if you eat properly, if you change your behavior, you will lose the weight. But there comes a point where the genetics and the biochemistry in our brain take over and the weight goes back up. It even happens in bariatric surgery patients. We know for a fact that they lose dramatically a lot of weight, but over time, unless they make significant changes that they can stick with, it goes back up. And that's because we never changed the genetics or biochemistry. Think about this. Our ancestors used to have to hunt their food. They would chase food and they might only eat once a week, but when they caught their food, they gorged themselves. Our bodies were made to store fat. We're made to store fat. Now, we don't chase our food anymore. We don't hunt our food anymore. We don't go out and dig for our food anymore. It's on every street corner. It's relatively cheap. It tastes great. And you can stick 1,500 calories between your fingers. So, we live in an environment that creates obesity because our bodies were made to store fat. So, what do we have to do? We have to treat this as a disease, and that's what we do here at Fast Clinical Weight Loss. Now, let me tell you a few factors here that you'll need to know about losing weight, and we can count them on our hand. So there are 5 points I want to give you today. Number 1 is you need to drink plenty of water. How much water? Well, drink water till your evening urine is clear. Okay? Drink water till your evening urine is clear. Number 2, there are some supplements that you should take. You should take 2,000 milligrams of omega-3 fatty acids a day. You should also take 2,000 units of vitamin D. Number 3, the third factor here, is you need to eat at least 3 times a day, and in our programs we recommend at least 5 times a day, but you got to eat at least 3 times a day. Number 4, you need to eat 4 protein servings a day. In our country, we get way too much carbohydrates. Our American diet is carbohydrates here, proteins here. Remember Dr. Atkins? He kind of flipped it. He said proteins and fats here, carbohydrates way down here. Our recommendation is a more balanced approach. Yes, we need to increase proteins, we need to decrease our carbohydrates, and that brings us to number 5. If it's a carb and it's white, it's not right. You need to eliminate the breads, the potatoes, the pastas, and the rice, and all the things created from those food sources. Now, you don't have to eliminate it for life, but when you're trying to lose weight, you got to cut those down or eliminate them as much as possible, and add more fresh fruits and vegetables, and get the lean meats in. Our programs here at Fast Clinical Weight Loss are designed to do exactly that. We also add coaching and accountability. We do it online, we do it by telephone, and for those of you in the area, we do it here in our office at the Fast Clinical Weight Loss Clinic. So, I invite you today to think about the things we've talked about. Think about the fact that you say to yourself, I just can't lose the weight. You've been on every program, and what I'm recommending is that you let us help you today. We'd love to have you become part of our program, part of our project here. Please get a hold of us. Our coaches, Emily and Raquel, would love to help you. My name is Dr. Greg Oliver. I would love to help you, and I'm inviting you to join us here on our website, read our blog, check out our videos at fatdoctor.tv, and we'll look forward to seeing less of you in the near future. Thank you.